Ready to talk about blood work in psychiatry? Ever wonder why your psychiatrist might order labs or why they don't? Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Let's dig in. Let me say this up front. Not every psychiatric evaluation needs blood work. In fact, I rarely order labs unless I have a specific reason. When I do, it's not to medicalize your feelings or chase scary diagnoses. It's because your brain lives in a body, and that body might be trying to tell us something important. Labs can help us do lots of things. They can help rule out medical causes that mimic mental health issues, to check for underlying contributions like vitamin deficiencies or hormonal shifts, to get a safe baseline before starting certain medications, or to monitor treatment effects that impact certain organs, metabolism, or hormones. It's never about checking a box. It's about being curious when something isn't adding up. So what kind of labs might we order and why? Let's break it down. A CBC, which is a complete blood count. This one screens for anemia, which can cause fatigue, low motivation, and worsen depression. Even mild or non-clinical anemia, especially in women, is linked to increased risk of depressive symptoms. It also checks for signs of infection or inflammation, which can affect how you feel. CMP, Comprehensive Metabolic Panel. This looks at liver and kidney function, which helps us make sure that the meds we pick are safe for you. It also checks electrolytes, which can impact mood, alertness, and energy. TSH, thyroid stimulating hormone, with or without T3 and T4. Both hypo and hyperthyroidism can look like mood issues, like depression, anxiety, or irritability. Even subtle shifts can interfere with treatment. Vitamin B12 and folate. These are key for mood, cognition, and energy. Deficiencies can cause brain fog, irritability, and emotional flatness. They're especially important if you're older, eat a restricted diet, or have gut absorption issues. Vitamin D. Okay, this one's a biggie. Low D is linked to depression, low emotional resilience, and fatigue. Yes, we make vitamin D through sunlight exposure, but you need a lot of direct midday sun on large areas of skin with no sunscreen. And most of us, we wear sunscreen as we should. Add darker skin or living up north, most people aren't making enough vitamin D naturally. Getting your level checked helps us know where to start. Hemoglobin A1C or fasting glucose. These test for blood sugar issues like prediabetes or insulin resistance. Why does this matter? Because certain psychiatric medications, especially antipsychotics, can raise blood sugar, even before you feel it. That's why we check a baseline and during treatment. A lipid panel. Some meds can increase cholesterol and triglycerides, especially atypical antipsychotics, things like olanzapine, quetiapine, or risperidone. That's where a metabolic syndrome comes in. This is a cluster of risks like high blood sugar, elevated triglycerides, low HDL, high blood pressure, and increased weight circumference. It increases your risk for heart disease, stroke, and diabetes. So again, we're not just protecting your mind, we're protecting your whole self. Prolactin. Some antipsychotics raise prolactin levels. That can cause sexual side effects, mood changes, or issues with your period. Urine drug screen, not about judgment, just to clarify. Sometimes it helps us figure out what's really going on. EKG, which is obviously not a lab, but can be important. Some meds, like citalopram or antipsychotics, can affect the heart rhythm. We check for QT prolongation. Pregnancy test. This is essential before starting meds like lithium or valproate. So when are labs helpful? Well, when your symptoms don't respond the way we'd expect, or when you're still tired or foggy, even with good sleep and support. When we're starting meds that need a baseline, or when we just want to make sure we're not missing something bigger. Even if labs come back normal, that's helpful. It rules out other causes and gives us confidence in your treatment plan. But sometimes labs aren't optional. If you're on lithium, we have to check levels, kidney function, and thyroid. If you're on antipsychotics, we have to monitor glucose and lipids. And if you're having side effects, labs can help us try to figure out why. And if we ask you to get blood work, please get it done. We can't move forward safely without it. And if you're anxious about needles or blood draws, tell us. We can often prescribe something to help you feel calm for that lab visit. You don't have to white knuckle your way through it. And sometimes labs just aren't needed. If you're improving, already had recent labs, or your symptoms are clearly connected to life stress, then we focus on you, your story, and your path forward. Because blood work is just one tool. Most of the improvements still happen through conversation, behavior changes, and while living your everyday life. I hope your brain is full of lab test goodness, no blood draw required. If you're feeling stuck or wondering if something deeper is going on, labs might be one way to get clearer answers. Be sure to grab more tasty tidbits at brainbiteswithdrb.com. Enjoy!